Okay, next is levator scapular muscle. Okay, this muscle, okay, the origin at the transverse process of atlas, axis, C3 and C4. Okay, atlas and axis. For those who don't know, okay, atlas is the other name for C1, axis is for C2. Okay, so basically transverse process of C1, C2, and posterior tubercle of C3 and C4. Okay, and it is inserted to the posterior surface of superior medial border of scapula. Ni lah. Okay, superior medial border of scapula. Okay, function to elevate scapula. Okay, actually this levator scapular muscle ni, okay, if you notice, okay, for body builder, apa yang weightlifter tu kan, okay, bila dia nak angkat the big apa tu lah, yalah, weight tu kan, masa angkat tu, okay, even if you go to the gym pun lah kan, okay, you try to lift up the weight from the floor tu, you shouldn't, okay, turn your head, nak tengok cermin ke kan, you shouldn't do that, because this levator scapula, when it was in action, it immobilized the column apa, cervical column. Okay, the immobilize the column during shoulder rotation. During shoulder you lift up the weight from the floor, you using all the shoulder, your pectoral girdle, you shouldn't, okay, pusing-pusing lah. The function, okay, the scapula, okay, innervation by, okay lah, dah dia originate from cervical region, so innervation from anterior rami of C3 and C4, ya. Okay, next, okay, rhomboid major and rhomboid minor. So basically lebih kurang je the same area. Major here origin from spinous process of T2 to T5, and then inserted to medial border of scapula. Rhomboid minor pula from knuckle ligament, okay, in the picture previously kan. Okay, still remember knuckle region, knuckle ligament here, and spinous process from C7 to T1, and then inserted to medial border of scapula juga. Okay, and the function is, okay, it retracts scapula. Okay, kalau you tengok pun, you can imagine if dia apa nama, contract, the scapula will be rotated. For example, kalau you use dumbbell, okay, you angkat dumbbell, okay, lift up dumbbell from floor to your side, you are using your rhomboid minor, rhomboid major muscle as well. Yeah. Okay, deltoid, actually this is the one yang have main involvement in main involvement in your shoulder motion. Okay, if you can see here, the origin, the origin ada 3 part tau. Okay, lateral 1/3 of clavicle, which is the clavicular part. So di sini acromion part, and then this scapula spine, the spinal part lah. Okay, 1, 2, 3. So nampak tak dia punya kata bulk, muscle bulk, and how important it is, and it inserted dekat deltoid tuberosity of humerus. Okay. Again, from the first lecture ni, deltoid tuberosity of humerus. So this is where the deltoid muscle inserted. For the function, because it has 3 parts, clavicle, acromion, and spine, scapula spine part kan. So function pun, it has different function lah. It works simultaneously, but it more like clavicular part. Okay, clavicular part here kan, clavicle, and inserted to deltoid tuberosity of humerus. So when it contracts, it menghasilkan menghasilkan flexion of your upper limb, of your arm lah, flexion of your arm, and it can internally rotate. Okay, you can say medially or internally rotate your arm. Okay, clavicle, dilate tuberosity, flex the arm, and also internally rotate the arm. For acromion, the tip here, okay, acromion part, dia abduct, okay, beyond 15 degree. Yang the first initial 15 is from supraspinatus. Then beyond 15 to 90 is deltoid, okay, it abduct beyond 15 degree. And for spinal part ni, yalah, scapular spine part, dia okay, extend your arm and externally rotate. Externally rotate, okay. And it innervated by axillary nerve. Axillary nerve dekat tadi kita tengok tadi dekat quadrangular spaces, kan? Okay. So this area lah. So easy to remember. Axillary nerve innervate deltoid muscle. Okay. And okay, you can watch this video to see how the muscle works. Okay, together. Okay, actually, when I teach you this muscle do this muscle do that, it's actually but in real life, in real motion, all this muscle works together. In fact, they have some muscle for abduction also helps in internally rotate or externally rotate, but we want to focus on the main function of each muscle. But in real life, in real motion, all this muscle works together. And you have to know that okay, dah masuk shoulder pula ni. Shoulder joint, okay, the most flexible joint, okay, you can rotate freely, but it's also unstable joint, okay, sebab dia move so freely, the glenoid pun so shallow, kan, so they easily to dislocate and everything. Okay, I know this is a very long lecture, but I think I've covered ni lah, pectoral and axillary region, as well as I also covered some other lecture. If I didn't mention this, you will not macam mana, you have no idea lah nanti, kan. So I have to mention about brachial plexus and shoulder joint, so that we will have lecture after this about all this, but to give you like introduction so that you get familiar with all this action of the muscle and terms. Yeah, hopefully you can finish okay, watching all this video. And I'm so sorry that it's a very dry topic, you feel bored. Tak apalah, talk sikit-sikit, okay. That's all. Thank you. Until we meet again in the next lecture. Assalamualaikum.